Okay, so I'm a pain management doctor, so this is right in my space. What causes knee pain? Well, I got to tell you, that's a complicated question to answer. Your knee is one of the largest and most complex joints in your body. You have three different bones coming together. You have ligaments, you have tendons, you have a meniscus, you have muscles, you have fluid. All this is coming together, and you have cartilage, and all these different structures can cause pain. Overuse of the knee can cause trauma to the cartilage, and that can cause you pain. What's really interesting about the cartilage is it doesn't really have any nerve endings in and of itself. And so as the cartilage breaks down over time, either from trauma or from damage or just old age, it's the cartilage will then damage other tissues. And specifically, once the cartilage wears down enough, then bone can start to rub on bone, and that can cause severe pain. Next slide. So treating cartilage damage has always been quite the bugaboo for orthopedic surgeons, and I'll let Dr. Eifler talk a little bit more about that. But basically, over time, the cartilage will wear down, and then eventually you have bone rubbing on bone that I mentioned. And when that happens, you have to seek out a surgeon to find out what are your options. Now, pain docs like me, we might try things like joint injections, local anesthetic, or steroid. If that doesn't work, sometimes we'll progress to things like Synvisc injections, which is just meant to lubricate and give you more like shock absorbers in your knee. And then sometimes we'll even try things like regenerative medicine, PRP, or stem cells. To be honest, a lot of that stuff just doesn't work. And so you end up seeing a surgeon who's talking to you about a total knee replacement. Next slide. So many people with severe cartilage damage, as I said, will eventually require joint replacement. And Dr. Eifler has done a lot of these joint replacements, and they can be great for patients, but we're always looking for minimally invasive approaches, right? Like things that will help your pain without having like a full-on replacement. And so this is where the Episurf knee system may offer another option. This is a program or a device that was brought to market by Episurf. And this is an experimental device. And so you'll hear a little bit more about that today. But the idea is that you can treat this cartilage damage without progressing all the way to a knee replacement. Next slide. And this actually might be where Dr. Eifler's taking over. So I'm going to come back at the end and help take a few questions. But Dr. Eifler, why don't you jump in and start to talk about the actual Episurf knee system?
Right. So let's move on to the next slide there, Nikki. So as we talked about, this is a clinical trial, which means it's an FDA trial to evaluate the safety and efficacy of this device. This device has a 10-year follow-up. Originally started in Sweden by Dr. Reed, who is an orthopedic surgeon who developed the implant based on some personal needs of his that found that there was a gap in services offered to treat an isolated femoral defect. So it has been around a while in Europe. It's been presented 24 times, over 24 times in the world congresses, the International Congress or Cartilage Registry Society, both in Italy and in China in 2017 and 2018 before the pandemic, as well as over the last few years. So it has some track record overseas, but it's brought here through an FDA trial for US to develop its own determination on the safety and efficacy, even though it has a 10-year track record outside of the US. Next slide. So how it works, next slide. So what we're going to talk about is people that have this device is for people that have an isolated femoral articular cartilage defect, meaning that the articular cartilage, the cartilage that covers the bone on the femur, which is also your thigh bone, is damaged, and it needs help through surgical intervention because, as Dr. Lynch mentioned, the non-operative measures failed. So there are different ways we can treat it. We can take cartilage cells from you. We can take allograft cells from patients and put them in as well. This is a device that's new, where we use MRI imaging to develop a 3D designed implant that's custom made just for that defect. So it's like having a mini knee replacement for just the area that's bad. If the rest of your knee is healthy and you have 1 or 2 lesions on the femur, then this is ideal for you. There are some inclusions and exclusions we'll go over later, but think of it as a knee replacement made for the isolated defect by leaving everything else in your knee alone. The device to put the implant in is custom made for you. The device that's actually going to be implanted into you is custom devised or custom made for you. And it's just designed to replace that defect in the femur. Next slide. So what it starts off with is an evaluation. We use MRI. MRI develops, there are special protocols that have been set up that basically outline the amount of cartilage damage you have in your knee. And it shows the extent in more detail than a standard MRI, because the protocols have been designed to just look at the articular cartilage in greater detail than your standard MRI. So it's a special type of MRI. The MRI that you may have received in the past doesn't work. It's a new MRI has to be taken to start this process. Next slide. So once it gets sent off, the people at Episurf and the Epic Knee trial developed this damage marking report. It shows areas of damage such as are on the screen, and the thickness and the width and the dimensions, and grades your knee and determines if this is an isolated defect and the rest of your knee does look healthy. Then based on that information, the surgeon and the study determines if you qualify for the study, and it's also used to help design the implant. Next slide. So once it's been determined that you qualify and you are a candidate for this, the Episealer and EpiGuide, the Episealer is the implant, the EpiGuide is the device or the jig that we place in your knee that's designed off the MRI and specific just for you. It's disposed of after you, so it's never going to be used in somebody else, and it's custom made. And then the implant is a cobalt chrome metal alloy that's also used in other orthopedic applications. So it's not a new type of implant, but it's specifically made for you. As this specialness about this implant, as well as being isolated, not replacing the whole left or the medial or lateral compartment or replacing the entire knee. It's replacing only the part that's bad, and it's been custom made for you through this 3D printing application. Next slide. So the surgery is done in a surgery center setting, an outpatient setting. You do have anesthesia, whether it be a spinal or a general anesthesia. We do make an incision on your knee to implant this device to be able to house the jig, as well as to implant the device. The incision will be based upon where you have the damage and where we need to get to. Next slide. That surgery is a same-day surgery. You go home, you're on crutches, and that's where the rehabilitation starts. You'll go home, you'll be able to move the knee. There will be no restrictions on the knee as far as movement. You'll be on crutches for roughly 2 to 3 weeks afterwards with some protected weight bearing, and then progress to full weight bearing. One of the advantages of this surgery over other isolated cartilage defects correction surgeries is when you use patient cells, you have to wait for those cells to grow in, kind of like planting grass and waiting for the grass to grow before you can play on the grass. That takes several months of rehab. This is just isolated implant where it's implanted and really ready to be used fairly soon. And that's why you can get rid of the crutches in a couple weeks, move your knee and start getting back to some normalcy. Now, it does take time to heal the incision. It does take time to get your strength back and the usual recovery. But friends of those of yours that might have had partial knee replacements or total knee replacements, the rehab is going to be an accelerated rehab compared to those rehabs. And it's going to be under the guide of the clinical trial and a physical therapist. Next slide. So how do we figure out if we're a candidate? Next slide. So basically, part of this is being seen by a provider to determine if you have isolated articular cartilage damage in your knee. That could be me, that could be Dr. Lynch, getting in contact with the study coordinators that they can evaluate and determine if you qualify. There are some inclusion and exclusion criteria, as I mentioned, that we'll go over here later, but you can look and get a rough idea and see if you qualify. Next slide. So the inclusion criteria, between 30 and 70 years of age is the typical criteria. We don't want to put these in skeletally immature individuals. This is more for patients who have reached adulthood. You have a single or one or two lesions instead of multiple lesions, but you can have up to two. And it's on the femoral side or the thigh bone side of the knee. You need to have some pain for a certain period of time. You have to be a certain BMI requirements in this study. And there needs to be quality of the ligaments, quality of the meniscus in your knee. You can't be bone on bone, have any type of prosthesis in the knee, and any other disease process such as rheumatoid arthritis that's going to affect the quality of the bone inside the knee, or allergies to metal. Next slide. So for more information, again, talk to your doctor, as I said, or get a hold of somebody in my office or the pre-screening process here that's set up through Episurf and PRG, and we can get you scheduled and see if you're a candidate.